So today's topic is the wound healing. So what is healing? Healing, it is a body response to injury with the goal of restoring normal structure and function. So wound healing refers to replacement of the destroyed tissue by the living tissues. So healing, it involves two processes. One is the regeneration, and other is repair. The regeneration, that process involves the proliferation of the parenchymal cells that leads to complete restoration of the original tissue, whereas the repair, it occurs when the connective tissue elements like fibroblast results in fibrosis and scarring. So the regeneration, it aims to restore the damaged tissue to the original state, both structurally as well as functionally, with minimal to no scar formation. So in regeneration, there is minimal or no scar formation. Whereas, so in regeneration, the original tissue, it is replaced by new healthy cells that are identical to the one lost, whereas the repair, it involves the formation of the scar tissue. So to bridge the gap in the damaged tissue. So that does not aim to fully restore the original tissue structure and the function. Instead, it focuses on the closing the wound and providing functional but different tissue. So sometimes both regeneration and repair process, they can occur simultaneously. That depends on the nature and extent of the injury or damage. Now let us discuss the healing. So wound healing, it occurs in three phases: inflammatory phase, proliferative phase, and remodeling phase. So what are the three phases? Inflammatory phase, proliferative phase, and remodeling phase. Now let us discuss step by step. The first is the inflammatory stage. So the inflammatory stage of wound healing, it occurs within the first 2 to 5 days after an injury. So first of all, when a blood vessel is injured, the platelets in the bloodstream, it becomes activated. So they adhere to the site of injury and form a temporary plug. So this plug would help to stop the bleeding by sealing off that damaged blood vessels. Immediately after an injury, the blood vessels in the affected area, they constrict to reduce the blood flow and minimize the bleeding. So this vasoconstriction, it is a rapid response to the injury. So here you will see vasoconstriction. The next step would be fibrin matrix formation. So fibrin, it is a protein that plays an important role in blood clotting. So during the inflammatory stage, the fibrinogen in the blood, it gets converted into the fibrinogen it will get converted into fibrin. So these strands will create a mesh-like structure known as fibrin matrix. So this matrix helps stabilize the platelet plug and forms a scaffold for the subsequent stage of wound healing. So in response to the injury or infection, various cells at site releases chemoattractant molecules. So these molecules act as a chemical signal. So that these molecules will travel along the bloodstream or the surrounding tissue. The next step is chemotaxis. So immune cells like neutrophils and macrophages senses these chemoattractants and responds by moving toward the source of signal. So this step is chemotaxis. So the immune cells, they are responsible for the various functions like phagocytosis, giving inflammatory response, and assisting in the removal of the damaged tissue and formation of the new tissue. So the common chemoattractants, they include like cytokinin, interleukin, tumor necrosis factor. So these are the common chemoattractants. Now let us discuss the stages of inflammation. The first is the early event in the inflammation. First of all, you will see immediately after an injury, there will be vasoconstriction. That occurs to minimize the bleeding and reduce the blood loss. Shortly after the vasoconstriction, you will see vasodilation. So the blood vessels, they will dilate, allowing the increased blood flow to the injured area. So this increased blood flow would bring more oxygen and nutrients. So the blood vessels will become more permeable. That means they will allow fluid and immune cells to move more easily from the bloodstream into the injured tissue. That could lead to swelling and the redness. Now, neutrophils infiltrate would appear. So which cells are the first immune cells to arrive at the wound? They are the neutrophils. Remember, for your exam, they will remove the dead tissues and prevent the infection. As the inflammatory response progresses, macrophages, another type of WBC, they become more prevalent at the wound site, and they play a role in clearing away the dead cells like bacteria and debris. So there would be production of the fibroblast. So what are the late stages of inflammation? The late stage involve the entry of the lymphocytes. So lymphocytes, they are type of WBC's blood cells that include T cells and B cells. T cells helps to regulate the immune response, and it helps in tissue repair. The B cells are responsible for production of antibodies. Appearance of mast cells. Mast cells, they are immune cells that contain granules filled within substance like histamine. So moving to the next stage of inflammation is the proliferative stage. So that is the second stage that occurs 2 to 3 days, 2 days to 3 weeks following the inflammatory phase. So during this phase, you will see various events like granulation tissue. There would be fibroblast activity, fibroblasts, they will play a central role during this phase as they will produce collagen fibers. The mesenchymal cells produce fibroblasts. So they are responsible for production of the collagen. So the fibroblasts, they are responsible for producing collagen that provides structural support to the healing tissue. You would see granulation tissue formation, there would be angiogenesis. Angiogenesis is the formation of new blood vessels. So that process is essential for the angiogenesis effect is essential for delivering oxygen and nutrients to the healing tissue. So example is the EGF, epithelial growth factor 1. It is the most common angiogenic. Heparin, TGF alpha, beta, prostaglandins, they also stimulates angiogenesis. So the next step is the epithelization. The epithelial cells from the edges of wound, they migrate across the wound surface, covering it with a new layer of epithelial tissue, and that is essential for sealing the wound. You would see granulation tissue formation that consists of fibroblasts, inflammatory cells, and newly formed blood vessels. The myofibrils helps to reduce the size of wound by contracting the wound edges. So that is important for the wound closure and minimize the scar formation. The next stage is the remodeling phase. It occurs 3 weeks to 2 years. So it is also known as maturation phase, and it is the final stage. So here the new collagen, it will form and increase the tensile strength of the wound. There will be reorganization, remodeling of the collagen fibers in the scar tissue. Over the time, the scar tissue will become less red and raised as collagen becomes more organized and aligned. So that will provide a more tensile strength. The scar tissue, it continues to contract, and thereby the size gets reduced. So in starting, the scar may be red, raised and firm, but later it becomes paler, softer and flatter with the time. So by the 4 to 5 days after wound, the wound contraction phase begins 4 to 5 days by the action of myofibrils. So wound contraction, it is an essential process in wound healing. So that process is characterized by centripetal movement of the cells that are known as myofibrils. So the maximum contraction, it occurs for 12 to 15 days, although it will continue longer if the wound remain open. So the rate at which the wound edges move toward with each other during wound contraction can vary, and it falls within the average rate of 0.6 to 0.7 mm per day. So now, what are the growth factors which play a role in the wound healing? So various types of growth factors. The first are the platelet-derived growth factors released by platelets, and they stimulate cell proliferation, particularly in fibroblast and smooth muscle cells. Other are the epidermal growth factors that promotes the growth and proliferation of cells like epithelial cells. It accelerates the healing of skin wounds and play a role in angiogenesis, as discussed earlier. The fibroblast growth factors, they are family of growth factors that promote the proliferation of fibroblast, endothelial cells and keratinocytes. Other are the vascular endothelial growth factors that are required for angiogenesis, insulin-like growth factors, or macrophage-derived growth factors. Now, the wound healing, it is accomplished by two ways: healing by first intention, that is primary union, or by secondary union, that is the healing by primary intention, also known as primary closure, primary union. It is a process that occurs when the wound is clean. The wound edges, they are close together, and they can be closed with clean wounds means there is no infections or foreign bodies. So they can be closed with sutures, staples, or adhesive strips. So wound healing by primary intention, it results in minimal scarring. So as the wound edges, they are close together and they are less low, there is less tissue loss to replace them. So what are the steps involved in the healing by primary union? What are the sequence of events? So the immediate after an injury, the blood initiates hemostasis. The blood vessels, they constrict to minimize the bleeding, forms temporary platelet plug to stop the bleeding. A fibrin protein involved in blood clotting is deposited to form a stable clot. This fibrin clot further prevent bleeding and provide a scaffold for the cell migration. So dehydration of the blood clot within the first 24 hours after injury, the blood clot they begins to dehydrate. So this process would help to strengthen the clot and stabilize the wound site. The next is within the 24 hours there would be movement of epithelial cells at the wound edges. So the epithelial cells begin to migrate across the wound surface. So that is necessary for the sealing the wound and initiating the formation of new epithelial layer over the injured area. So as the wound healing process continues, there is a proliferation of fibroblast, angiogenesis, and further development of granulation tissue. So that all the collectively contribute to repair and regeneration of the damaged tissue during the primary intention. So there is precise alignment of wound edges and repair and rapid sealing of the wound. Within 10 to 14 days, there is scab formation, a scab or crust that is formed over the wound site. This scab is composed of dried blood, fibrin, and other materials. So it has a protective barrier. Beneath the scab, the epithelial cells migrate and proliferate to cover the wound surface. This process is epithelialization. So it helps to seal the wound. Over time, the wound edges come together as fibroblasts produce collagen. So that results in fibrous union. Now let us discuss the healing by the secondary intention. So the healing by secondary intention, it is a wound healing that occurs when wound is left open and it is allowed to heal gradually. So this type of wound is seen when the wounds, they are larger, deeper and contaminated, and they cannot be easily closed with the sutures. So the healing by secondary intention can result in more extensive scar formation and may take longer than the healing by the primary intention. So healing by secondary intention, there is the cavity is filled with blood and fibrin clot. Acute inflammation occurs at the junction of the living tissue. That is the earliest sign. So there is contraction of wounds due to myofibroblast, and new capillary fluid brings macrophages, neutrophils and fibroblasts. So the collagen tissue will be arranged transversally. The epithelial layer will be covering complete. So these are all steps involved in the full thickness of epithelium, you can see here, is restored. Thick collagenous tissue formation, scar tissue becoming less vascular over months. Now, what are the factors that would influence healing? Let us discuss them. That can be systemic factors or the local factors. Systemic factors that delay or retard wound healing. Nutrition like protein deficiency, vitamin deficiency. Vitamin C will inhibit collagen synthesis. Zinc deficiency. Metabolic status like diabetes mellitus. Circulatory status like inadequate blood supply. Hormonal like glucocorticosteroids, they can inhibit collagen synthesis and decrease the inflammation. So remember the systemic factors, all that. The local factors are the infection, most common cause of delayed wound healing. Persistent injury, mechanical factors like motion, early motion can retard or delay the wound healing. Foreign materials, small wound heals faster than the large one. Incisions heal faster than the blunt traumas. So all these are factors that delay healing. Complication of wound healing, you can see the deficient scar formation, excessive formation of repair component, or could be exaggerated contraction. So deficient scar formation can lead to wound dehiscence, that is the rupture of wound, that is most common seen after abdominal surgery during coughing or vomiting, or there would be ulceration due to the defect in the continuity. So excessive formation of repair component, you could see either keloid or hypertrophic R formation due to excessive collagen, or there would be excessive granulation tissue that protrudes above the level of surrounding skin, and it can impair the growth of the epithelium.